my name is Keri Stevens, and I'm the co-chief editor of Plastic Surgery Practice, part of the MedCore Podcast Network. Today, I'm joined by Dr. Darren Smith, a New York-based plastic surgeon who provides cosmetic enhancements such as breast augmentation, liposuction, and tummy tucks. Dr. Smith recently wrote an article for PSP about the role of energy in male body contouring, and we wanted to learn more about the process. Dr. Smith, thank you for joining me today.
My pleasure to be here.
Absolutely. And just to start, can you talk about your background and about your practice?
Absolutely. So, I my interest in plastic surgery really began with my dad. He's now a retired
Okay.
orthopedic surgeon, and when I was in high school, I joined him to watch in the operating room, and he plated some bone or something. I didn't know what it was at the time, but there was this big piece of metal, and they could not get the wound closed over it. And so they called in a plastic surgeon, and he closed the wound, and it was like magic.
Okay.
And I decided I wanted to kind of be the magician. And that's what kind of got me into plastic surgery. And from there, I initially kind of had a focus on the anatomy of the face and skull. I was fascinated by craniofacial surgery. So I did a fellowship in craniofacial surgery. And then I really took a special interest in the aesthetic end of things and how we could really kind of make people happier and feel better about themselves and kind of address any insecurities that they may have with some of the treatments that we could provide. So I did an aesthetic surgery fellowship. So now I am privileged to own a practice on the Upper East Side of Manhattan in New York City, where we're dedicated to aesthetic surgery of the face, breast, and body.
That's awesome. Okay. And so in the article, you wrote about the role of energy in male body contouring. And can you please explain the different components of body contouring?
For sure. So I think that at its core, body contouring encompasses any procedure that is designed to change the shape of the body. And in general, we're going to be either adding volume to an area or subtracting volume to an area. It's more common to subtract volume than to add volume. And the way that we subtract volume is either through non-invasive or minimally invasive techniques. Non-invasive things would be things like M-Sculpt Neo or cool sculpting. And minimally invasive techniques are things like liposuction. On the other end of that spectrum are kind of the classic invasive techniques like tummy tucks and arm lifts and thigh lifts. And essentially, whenever we remove volume, when we remove fat from an area, that's one piece of things. The other piece is what do we do with the skin envelope? So, if we remove too much fat, for the skin to be able to handle it, you're going to see signs of skin laxity. It won't be able to contract enough to give you the result that you're looking for. It's almost like deflating a balloon. So, the example that I always give patients is if you have a spectrum where on one end of it you have a 20-year-old woman who's never had kids, she's never smoked, and on the other end of that spectrum is a 90-year-old woman who's had 7 kids, she's smoked all her life. The 20-year-old is going to have better skin elasticity. If we do a little liposuction, her skin's going to snap back and you're never going to know what happened. But if you take the 90-year-old and do that liposuction, you're going to kind of have this loose, hanging, maybe pruny looking skin. And, every patient is somewhere on that continuum. And, classically, if you were to take someone and do something to remove fat, say liposuction, and they did not have good skin contraction, you'd be kind of obligated to do something more invasive and cut the extra skin out, right? That's exactly what a tummy tuck is. It's a way of redraping the skin envelope to better fit the kind of volume contour that you've achieved. What energy has allowed us to do is treat more people within the minimally invasive realm. So now if you have someone with moderate skin laxity and you do some liposuction in the past, they would have, likely had some visible waviness or hanging skin, what have you. Now we can take one of several energy-based devices and use that to tighten the skin. So you can actually avoid doing an abdominoplasty in somebody. And this is, I use the example of a pregnant woman, but of an older woman. But I mean, you could say the exact same thing and use men for the example. And the reason that I think that this is that energy-based devices are particularly germane to male body contouring is that while the number of men that are seeking out cosmetic procedures is certainly increasing, I do think there's still a taboo around this stuff, and men are likely to be more reticent to have a cosmetic procedure performed. And I think that kind of the less that they have to do, the more likely they're going to be to feel comfortable with the option. It's much easier to go someplace and kind of feel comfortable having a little liposuction than it is to go and have a whole abdominoplasty. So, if there's a man that
Yeah.
has, some fatty excess and some loose skin, in the past I would have said, hey, you're really going to need an abdominoplasty to see the result that you want. They're going to look at me like I have 3 heads. They're not going to get an abdominoplasty. It's pretty rare for men to get abdominoplasties. But now if I say, hey, I can really get rid of the extra fat, and I can also tighten your skin envelope with another minimally invasive procedure and get you a pretty nice outcome without having to perform a full abdominoplasty, then you're going to have a lot of guys kind of jumping into the line. And I think it kind of opens up a whole world of possibilities.
Do you think this taboo is still decreasing though? Because you mentioned it now, and you actually mentioned in your article too about the male taboo for plastic surgery. Do you think it is decreasing, and what do you think will take for it to decrease?
First of all, I think plastic surgery and aesthetic procedures and treatments as a whole is something that's becoming a lot more mainstream. And I think that, first it's
Yeah.
starting with women. I think that the taboo for women is now, maybe I wouldn't say non-existent, but a lot less than it was 10 years ago. Plastic surgery used to be a
Yeah.
secret, right? Nobody wants you to know they had their nose done or their breast done or a tummy tuck, whatever. Now people are going around saying, "Oh, I have my nose done by so and so." It's kind of become a status symbol. So I think it's something people are discussing very openly, and I think there will be kind of a trickle down effect, and from to kind of have the same thing happening with men over time. I think that as kind of it becomes more of a mainstream acceptable topic to talk about, maybe even something that people are bragging about, then I think the taboo is going to continue to fade. And certainly as there is more talk about it in the media, or if you have, male celebrities being open about what they're doing, then yeah, I think that's going to really kind of knock out the taboo as well. And kind of the fuel on this fire obviously is social media. It's so easy now for people to share what they're doing and talk about
Yeah.
it and interact with their fan base, or with their friend circle. I do think that the stage is set for that taboo to continue to decline.
Are you seeing more male patients, and especially again with the rise of the energy-based devices?
Yeah, we're seeing a lot more male patients. I think, when I started my practice about 5 years ago, I'd say that our practice was about 20% male. At this point, I think it's probably 35% male. So it's still,
Yeah.
predominantly female, but we're definitely seeing a significant rise in the number of men in our practice.
Yeah, and we've been hearing that a lot. A lot of podcasts, a lot of the plastic surgeons have been talking about how the demographics is changing a bit in the plastic surgery among plastic surgery patients. And like you said, I do think social media is playing such a role where people are, talking about these conversations, like you said, were secrets for before. But okay, so back to the energy-based devices. So your article
Yeah.
mentions the body tight body contouring method. What exactly is it, and how is it advancing the aesthetic sector?
Yeah, so body type to me is kind of the most powerful, minimally invasive body contouring device there is, outside of liposuction itself. What Body Tight uses, and I'll just say I have absolutely no relationship with the company that makes the device, which is InMode. I just like it a lot, so I use it a lot and I talk about it a lot. It's a bipolar radio frequency device, and it essentially consists of a very thin wand that goes through a standard liposuction incision and stays under the skin. Then there's a larger piece that stays outside the skin, and you kind of sandwich the skin you're treating between those two pieces. And each of those wands is a pole that transmits radio frequency energy. So you're essentially transmitting this energy between the two poles across the skin. The skin is treated almost like a resistor. So heat is generated, and that heat tightens the skin by causing collagen and elastin production. It also actually functions to tighten the fibroseptal network that is connecting the skin to the deeper soft tissues. So you really get this nice kind of global shrinkage of the soft tissues to showcase the contour that you are able to achieve by removing some fat with liposuction. The other point that I'll make is the other device that people talk about a lot in this space is J plasma, which is unipolar radio frequency energy. So that's a device that just goes under the skin and it kind of shoots out radio frequency energy in the form of plasma. I've never really liked that device. I think that you're kind of at risk for having more problems with it because it gets very hot very quickly and the energy is not really directed. It kind of goes everywhere. So whereas with the BodyTite, you're kind of just shooting energy between these two poles that are actually measuring the temperature in real time to keep you in a safe range. With the J plasma device, you certainly don't have directional control. The energy is going kind of everywhere from the tip of the device, and the temperature control is not nearly as precise either. And actually, a few months ago, the FDA issued a warning about using the J plasma device for skin tightening because they were seeing some real issues with it. There were burns. There were even a couple cases of muscle breakdown and rhabdomyolysis, where kind of the system was getting overloaded with muscle breakdown products, and people were getting pretty sick from it. Now, these are all very rare things, and I'm not trying to paint kind of an unfair picture, and there are certainly complications that are possible with the BodyTite device too. But, in a head-to-head, when you're talking about elective procedures, I'm always going to kind of choose the safer approach, and I really do like the BodyTite for that reason.
Interesting. Yeah. Okay, and let's also talk about non-invasive male body contouring methods. So what devices and techniques are you currently having the most success with?
Yeah, so for a long time, the gold standard in non-invasive body contouring was cool sculpting, which uses cryolipolysis to kill fat cells. And in theory, it works nicely. Over the past few months, there's been kind of this uptick in reporting of, an unusual side effect of cool sculpting, which is paradoxical adipose hyperplasia, which is where the fat actually grows instead of shrinks. After Linda Evangelista came out and reported that she had this happen, so now a lot more people are aware of it. So I actually don't offer cool sculpting. When I finished my fellowship, I was recruited into the practice of someone who does a lot of cool sculpting. So I kind of saw it for what it was. I never really loved it, and I never decided to offer it in my own practice. And then I certainly have had that kind of decision reinforced by this whole recent thing that's been going on with this uptick in paradoxical adipose hyperplasia cases. So what I really like for non-invasive body contouring in men, again, no relationship with the whatsoever, it's just what I've researched and what I use and that I think it works well for a lot of people, is a device called sculpt Neo. And sculpt Neo combines radio frequency energy and electromagnetic energy to provide or to achieve body contouring. And the radio frequency energy generates heat that destroys fat, and the electromagnetic energy pulses the muscles to make them do these. They're called, the company calls them super maximal muscle contractions, which is kind of just a fancy way of saying they make your muscle pull really hard. And so in a 30-minute session of this, you're going to do the equivalent of 24,000 muscle contractions. On average, there's a 25% increase in muscle mass and a 30% decrease in fat volume over the course of 4 30-minute treatment sessions. And the other nice thing about the device is the radio frequency energy actually also heats skin, so it tightens skin. So it's kind of this triple threat approach between tightening skin, killing fat, and building muscle that is really nice. Now, again, it's not a magic bullet. The machine does not work miracles. You're not going to take a large person and suddenly make them a very small person with a six-pack. What I like to think of it as, it kind of brings you to the next level. So if you're a little bigger than you want to be and you do sculpt Neo, you'll probably lose some abdominal fat and you'll look a little more fit. On the other hand, if you're already pretty fit, maybe you don't see a six-pack yet and you do sculpt Neo, maybe you'll start to see a six-pack. Or if you're someone who's fortunate enough to have a six-pack and you do sculpt Neo, then it's really going to make that six-pack pop. So it's all about kind of this incremental improvement. And that's what I think that device is really nice for. And you can use it almost anywhere on the body.
That's interesting, definitely. So, as a last question, what excites you most in the aesthetics field right now? And, in the body contouring segment of it in particular?
Yeah, I think that, there are new devices coming out so frequently, and some of them are just totally crazy, but some of them are pretty cool. And what excites me is just the amount of thought and energy that's going into this space. And every so often, something comes out, and you're just like, "Wow!" I really think that we're rapidly evolving, and I think we're going to be able to continue to kind of achieve more excellent results with less intervention as time goes on. And the other kind of caveat I want to give is I would never say that these devices can replace surgery, right? Like you're not going to get a tummy tuck like result with Body Tight, and certainly not with M-Sculpt Neo, but they're a way of taking someone who, maybe would be satisfied with a slightly less dramatic result, but doesn't want the downtime, and gives them an option to have one of these procedures in a way they couldn't achieve that before. So I think as the technology advances and we're able to do it more and more, we'll be able to kind of amp that pattern up of being able to help people that want to see a change but don't want to have surgery, or want to have only kind of minimally invasive surgery without a lot of downtime. And they're going to be able to see some really nice changes as time goes on.
No, that's great. Well, thank you so much, Dr. Smith. It was a real pleasure speaking to you today. And I encourage everyone to check him out on Instagram at NYC Plastics Doc. And be sure to check out the MedCore Podcast Network for the next episode of the Plastic Surgery Practice Podcast. And in the meantime, to check out on the latest industry news, please check out plasticsurgerypractice.com. Until next time, take care.